Hello everyone, my name is Wendy Castellino and I'm a psychotherapist over 30 years and I use CBT techniques and EMDR. So today I want to talk to you about social anxiety. So have you ever been in a social situation where you felt really nervous? Maybe starting a new job caused you to sweat a lot on your first day, or maybe going to a party where you didn't know anyone gave you a nervous stomach. So these are really normal feelings that most people experience at different times in their lives. But social anxiety is a much different experience. It can be really difficult and interfere with simple day-to-day activities such as going to work, attending social gatherings such as parties, or even going to the supermarket. So, what exactly is social anxiety? So, one way of describing social anxiety is intense anxiety or fear of being judged, negatively evaluated, or rejected in a social or performance situation. There's also a fear of appearing awkward or dumb. That can really intensify the anxious feelings that people feel and often leads to avoiding the social situation altogether. Since avoidance is a really common response, social anxiety can be a life-limiting problem if left untreated. So people who avoid, then that turns into missed opportunities, missed experiences or relationships. And this can lead to low achievement in school or at work. It can lead to poor social skills, low self-esteem, social isolation, which results in depression and even suicidal thoughts. If this sounds familiar, then believe me, you are not alone. So the criteria for diagnosing social anxiety is persistent, intense fear or anxiety about specific social situations because you believe you will be negatively judged, embarrassed, or even humiliated. And then avoidance of anxiety-producing social situations or enduring them with intense fear or anxiety, or excessive anxiety that's out of proportion to the situation, or anxiety or distress that interferes with your everyday living. In addition, there are physical symptoms that sometimes accompany social anxiety. These symptoms can include feelings of intense fear, a racing heart, turning red or blushing, excessive sweating, dry throat and mouth, trembling, fear of eating or drinking in front of other people, swallowing with difficulty, muscle twitches, particularly around the face and neck. So, how do you treat this? How do you overcome social anxiety? So, the good news is that it is a treatable condition. The first step to getting help is speaking with a therapist who can provide you with a diagnosis and a treatment plan. You can also be helped with medication. So cognitive behavior therapy is a highly effective method of treatment for social anxiety. CBT generally consists of about between 12 to 16 sessions and would include things like exposure strategies to specifically work on your thoughts and your feelings that maintain this problem. Research suggests that once in therapy, the dropout rates are really very low and the response rate to therapy is about 75% success rate. Another form of therapy is called exposure therapy. This is where you're exposed to one or more anxiety-producing social situations. This happens in a controlled environment where you learn to practice coping strategies rather than avoidance. So, living with social anxiety doesn't have to be a devastating, life-altering condition. With proper therapy, diagnosis, treatment, many people have learnt to overcome their problems and to lead a successful and fulfilling life. So if you want any more information about social anxiety and how I can help you, please contact me via my website, which is called Wendyc.team. That's Wendyc.team. Thank you.